Hi, this is Dr. Hussain from DMH Functional Medicine. Let's talk about iodine in thyroid health. And of course, this is just for informational and educational purposes. This is not personalized medical advice. You need to see your doctor if you have any health issues. So iodine is one of the few micronutrients where we could say it's nearly only relevant for the thyroid gland and the production of thyroid hormones. There are other tissues that can accumulate iodine, for instance, the salivary gland or the breast tissue, skin can also. But we don't really know what the role of iodine is in those tissues. But at least with the thyroid, we have a very clear understanding of how important it is, and iodine is really super important for the production of thyroid hormones. But with the other tissues, we are yet not fully clear about why it is that those tissues take up iodine. Anyway, iodine attaches to tyrosine on the thyroglobulin in the thyroid gland and forms monoiodotyrosine. Or if two iodine molecules attaches, then we call it diiodotyrosine, T1 and T2. Those two can then go together. For instance, T1 goes together with T2 and forms T3, and T2 can go together and form T4. Keep in mind, T4 is the inactive form, and this is nearly 80% of the thyroid hormones produced by the thyroid gland is T4, and 20% is T3. T4 then travels to the periphery and is converted to the active form T3, and around 60% of that happens in the liver, 20% in the kidneys, 20% in muscles, and 1–2% in other tissues. But this is the active and this is then the inactive. As I said, it's primarily used by the thyroid gland. Deficiency can cause goiter. That is basically an enlarged thyroid gland. Sometimes it's very visible, very clear, and sometimes the enlargement can be more limited, but it is visible or palpable also. It can also lead to hypothyroidism. Again, it's a very important part of the thyroid hormone. So if you're lacking in iodine, it can cause you to develop hypothyroidism apart from goiter also. Many countries, the salt in many developed countries, the salt is usually enriched with iodine to ensure sufficiency. And in many countries, this is not much of a great concern, but in developing countries, you will see people with iodine deficiency. And it's estimated that nearly 2 billion people, 25% of the world population, is at risk of iron deficiency. So although it may not be much of a problem where you live, it doesn't mean that it's not a big health concern. It is a huge health concern globally, in a global perspective. So this was our brief introduction to iodine in thyroid health. I hope you liked the video, share it with your friends and family, and subscribe to our channel and click the notification bell so that you're updated as we bring in new videos. If you have any suggestions for videos you want us to talk on, then write us and we'll consider that also. Thank you.